Hi Brittany, my name is Jacqueline. I'm going to be your nurse today. How are you?
Good, how are you?
What brings you into the office today?
Came in for a complete physical for my soccer game.
Okay. Do you know what today's date is?
Date December 1st,
And what time your appointment was?
3 o'clock.
Do you have any pain or discomfort anywhere?
No, ma'am.
Okay. I have noticed that Brittany appears to be her stated age. She appears to be well nourished. She's maintaining good eye contact during questioning. No apparent distress. She's dressed appropriately for the weather. She appears to be well groomed. Her hands and nails appear to be well kept. Her posture appears to be erect. Her gait was steady when she walked in. She's alert and oriented, and no signs of physical deformities or involuntary movements. Prior to entering the room, Brittany's height, weight, blood pressure, heart rate were taken, and the Snellen eye exam was completed, and her vision was 20/15. Brittany, if you notice any pain or discomfort during the examination, please let me know, and I'll investigate it further. Palpating your scalp. I'm going to be checking for any lesions or deformities on your scalp. Hair is well distributed, even, healthy, and clean. Assessing cranial nerve 7, which is facial nerve. I'll be assessing facial symmetry and expression throughout the exam. Brittany, I'm going to palpate the straight bone in your temporal area. Can you open your mouth for me and clench your teeth? That's assessing for TMJ. No clicks or pops noted. Can you raise your eyebrows? Close your eyes really tight. Okay, now puff your cheeks and smile at me. Okay. Palpating the maxillary and frontal sinuses. Are you paying attention to this with that? Okay. Inspecting her eyes. I noticed that Brittany's eyebrows and eyelashes are evenly distributed. Assessing the conjunctiva. I'm going to have you look up for me. And the sclera looking down. And I noticed the conjunctiva is clear and the sclera is white. And I note her cornea and her iris. Assessing cranial nerve 2, which is the optic nerve. Brittany, I'm going to have you cover up one eye and look straight at me. And do you see my fingers over here in your periphery?
Yes.
Okay. And again on the other side. Do you see my fingers over here on the side?
Yes.
Okay. Assessing cranial nerves 3, 4, and 6, which are oculomotor, trochlear, and abducens. I'm going to assess the red reflex of the eye, the optic disc, and the fundus, and I'm also assessing the retinal vessels in the eye, and they appear to be intact. Her pupils are equal, round, and reacting to light and accommodation, and I noticed that they're restricting bilaterally. Following my finger, I'm going to assess the 6 cardinal positions of gaze. Just follow my finger. Pretty good. And checking for convergence, I'm going to have you just watch as my finger does it. Okay. Assessing the ears, observing the external structures for alignment and symmetry, noticing if there's any drainage or abnormal characteristics to the ear, pulling on the auricle, and pushing on the tragus. Any pain or discomfort with that?
No.
Okay. I'm pushing over there. Then I'm going to use the otoscope and look inside your ears at the tympanic membrane. Noticing that it is pearly white. And observing the position and integrity of the ear, and they're intact. Assessing bone and air conduction, I would use a tuning fork. But since I don't have one, if I did the Weber, I would put the fork on top of the head and have her let me know when the vibrations were done. And for the Rene, I would put it on the mastoid bone, and that would assess air conduction. Cranial nerve 8 is acoustic, so I'm going to whisper a number in your ear, and you can just tell me what the number is.
99.
And this side?
23.
Okay, good. Assessing her nose, I'm observing the symmetry and any lesions on the outside of her nose. I'm going to occlude each side to check patency. Okay. Looking inside the nose, I'm going to assess the nasal mucosa, the septum, and the turbinates. You don't usually assess cranial nerve 1, but if I felt that there was something, then I would have her do a couple different smells and tell me what they were. Assessing mouth and throat, can you show me your teeth? Say ah. Looking at her teeth and her gums. And assessing that her tongue is midline. Can you raise your tongue through your mouth for me? the floor of the mouth and buccal mucosa are intact. And noticing that she has tonsils, then I would grade them as a 1. Assessing cranial nerve 10 is the vagus nerve. So make a swallow for me and stick your tongue out. Move it side to side. Very good. And if I had a tongue bleed, I would pre-warn her, and I would assess her gag reflex, and I would check for fasciculations or atrophy of her tongue, and to make sure the uvula was midline. I'm going to auscultate the carotid arteries, listening bilaterally for any bruits. And I don't hear any. Just assessing for the thyroid. I'm palpating on both sides of her trachea. Can you swallow for me? And I notice that the thyroid's moving up and down, and I don't feel any masses. Palpating the neck for lesions, masses, or deformities. Have you looked down for me into the side? I'm assessing the lymph nodes, and look to the other side for me. And any pain or tenderness with that? How about there? Okay. For video's sake, she's not going to be exposed, but I would assess the upper extremities, posterior and anterior, for distribution and any irregularities. For range of motion of your neck, move your head up and down for me, and side to side. Okay. Checking resistance, which is cranial nerve 11, spinal accessory. I'm going to place my hand on your cheek and have you push against my hand. And I'll be looking at the sternomastoid muscles, and then again on this side. Okay. I'm going to put both my hands on your shoulders, and you just shrug up and down. Okay. I would be observing anterior chest and posterior chest for masses. I would check depth and rhythm of breathing along with symmetry. I'm going to look at your back for me. On each side of her back, I'm going to palpate the outer aspects of the spine for crepitus, pulsations, or tenderness. And for tactile firmitus, so Brittany, can you please say 99?
99.
And again?
99.
And
99.
again. Okay. And I don't feel any tactile firmitus with that. I'm going to palpate your spinous process. Let me know if you feel any tenderness. And percussing the lung fields, I will be assessing for tympany and dullness along both sides. Auscultating breath sounds. I'm going to have you take in a couple of deep breaths for me. Auscultating all lung fields, checking for any adventitious lung sounds. And again. And again. Okay. On the anterior chest, I would also percuss her lung sounds, but for video's sake, I'm not going to expose her. Auscultating breath sounds anteriorly. Take a deep breath. I don't notice any adventitious breath sounds. I'm going to listen to your heart tones. First, I'm going to listen to the second intercostal space, right sternal border, and that's where the aortic valve is. And it's where the S2 is louder than the S1. And if I heard an abnormality, I would have her lean forward and I would listen. Second intercostal space, left sternal border, is the pulmonic valve, and that's where the S2 is louder than the S1. Third intercostal space is Erb's point. S1 and S2 are equal. And this is where you generally hear a heart murmur the easiest. Fourth intercostal space is the tricuspid valve. S1 is louder than S2. And fifth intercostal space, midclavicular line, is the mitral valve. And here's where you listen to the apical pulse, and you listen for 1 full minute. And S2 and S1 are normal, and I don't hear any murmurs. Inspecting the upper extremities, I would palpate your brachial pulses, your radial pulse, and check capillary refill of your fingers. Capillary refill is brisk. She's pink, warm, and dry. no masses or lesions, and no edema. Okay, Brittany, mimic what I do. Just hold your hands out and rotate your wrists back and forth, and do that. Just put your arms up and back down. And can you raise your arm up above your head, and then again the other arm up above your head. Okay. For strength, I'm going to have you squeeze my fingers. Okay. Now, press up with your hands on my hands. Okay. And now press down. You feel any pain or discomfort whenever you do that? Okay. I'm going to have you lie on the bed. I'm going to assess the abdomen for contour and check for skin. Contour is flat. Umbilicus is midline, and visual inspection, I don't see any pulsations or movement within her abdomen. The right upper quadrants where the liver and gallbladder are. Left upper quadrant is the spleen. Right lower quadrant is the appendix, and ascending and descending colon is the transverse colon. I'm going to auscultate all 4 quadrants of her abdomen for vowel sounds. And I should hear 5 to 35 within 1 minute. And if I don't, then I would listen for a full 5 minutes in each quadrant until I heard vowel sounds. Her vowel sounds are active. I'm going to listen for, see if I can hear a renal artery and the iliac. And for video's sake, I would not expose her lower extremities, but I would also listen for a femoral pulse. 3 fingers breadth above the umbilicus is her abdominal aorta, and I would listen there for a buoy, and I don't hear anything. Cussing the abdomen, hollow would be ear. Dull is bone, and flat is organs, palpating all 4 quadrants. For palpation, I would palpate lightly, about 1/4 to 1/2 inch, attempting, and then if I needed to go deeper,